Hello, everybody, and thank you for coming together today, joining us in the LEAP program for the Role Emerging Placements. We're quite excited for this event, and we've got pack-jammed program with very inspiring speakers today, sharing their experiences and stories. Joining me today is Gary. Gary is Voluntary Charity Social Enterprise Program Director for Humber and North Yorkshire Health and Care Partnership, which aims to connect the voluntary sector with the health and care partnership. The VCSC sector is a crucial part of health and care for people and their partnership, recognizing the value of working collaboratively with the sector. We've got a program which we're going to do a bit of introduction to the role emerging placement by Fiona Howlett. Then we're going to have a breakout room to discuss why REP is important, what's the benefit from it, how does it add value, and then followed by a repurposing student placement, a trio presentation by a student, a mentor, an educator, Melanie Chudley, Chris Richards, and Rebecca Robinson. It's going to be so inspiring sports story to really listen to, followed by a pioneer rep, charity and physio, Lucy Aldridge, who did a great pilot with charities and like really to share this experience with us. Then Sarah Pemberton is joining us from Education England to talk about placement, tariff, and clinical placement. Then Gary's going to greatly support the questions and answers sessions and have a breakout room to say, right, what can we do to make this happen? And then finally, we'll close it with some opportunities for people to express interest if they want to join us from now further with any actions that we want to do. I would like to take this opportunity to explain what is LEAP. What does it stand? LEAP stands for the Learning Environment Assessment of Placement and Placement. The LEAP program is about creating healthier region, where every learner on clinical work placement has the opportunity, the support, and the infrastructure to thrive in their chosen health and care career. So I want you to look at this passion flower and try to admire its beauty. Try to examine its structure and each part and the complexity and the layering that delivers this overall shape. I was sitting in my garden the other day, just admiring how beautiful it is, touching it, smelling it, and at warm sunlight like yesterday. This flower inspired me and gave me the confidence that beautiful structure can come together to deliver a beautiful care. Why? Because we are all passionate, because we all care. Like I said, the passion flower inspired me, so I kept it here in the corner for you, and have made an association with its color and structure to design our role emerging placement framework. You see, it all starts with people in the center of everything that we are doing. Who are the people? It's me, you, and everyone else. People who would like to receive the services at the right place, in the right time, with the right people. Services that we, the people, may and receive it at any time and in our life. Services for all the population that keeps us well, fit, and live with maximum level of participation and production. Primary care, education, work, community, leisure, charity, voluntary, private, everything else around us. It's basically our serving community that shapes our culture and future. The services that are rich, which is rich in its learning environment for all of us and for the future workforce, the learners that will shape our future workforce, all those who have or may consider career in health and social care, our learners who should represent our population we serve, diverse, inclusive, maintaining their individuality that makes us unique and special, our learners that have the passion and the ambitions to serve and develop services that we deserve. Develop services that shifts the relationship between the health and care professionals and people from being asked, what's the matter with you, to being asked, what matters to you. Shifts from being told what to do to being an active partner in the conversations and decisions. All of this with the support of Higher Education England, higher education institutes, our universities, that do not only deliver and support professional knowledge and behaviors based on growth, but can also identify and understand the learner's individual needs and inspiration to address health and care inequalities and build a better community and culture. Let's shed the light on our educators. Can deny that one of the most satisfying elements to our profession is when we empower the people. We empower our future workforce, create a learning mindset and culture that thrive on experiences that will only make us readier, resilient, and person-centered. This is all nourished by a system leadership, leaders that are open to opportunities, facilitated by the latest digital and technology, greener and innovative, to shape the evidence and provide the data, leadership that builds workforce skills to care for our people, a community culture that provides equity, diversity, inclusion with a sense of belonging, all co-produced and designed for the delivery of quality and efficient care. Just remind you that each part is important to make the whole beautiful. So I'll stop sharing now and introduce you to the next section, where Gary is going to tell us how are we going to embrace the day. So hand to you, Gary.
Yeah, thank you, Hannah, and thank you for the introduction. So I'm Gary Sainty. I'm the VCSE Programme Director for Humber and North Yorkshire Health and Care Partnership. And like Hannah said earlier, effectively that's trying to connect the voluntary sector up to the health and care system and the services that are provided. Click on to the next slide. Just take a quick second to kind of say what the VCSE Collaborative is about. And as you can see on the screen, it's about influencing, it's about collaboration, it's about enhancing the role of the sector and being that key strategic partner. Sorry, next slide. So there's something today around why we're involved. Why is the VCSE sector sat around the virtual table, should we say? And it's around the workforce of the system, which is more than just our traditional viewpoint. So it's more than doctors and nurses. We've got lots of students and lots of opportunities, and health and care takes place in many different settings, not just hospitals. So the VCSE sector is very much part and parcel of that. We have the opportunity to look at problems and challenges that we've faced for a long time and look at how do we do them collectively and differently. So I always say from a VCSE sector point of view, we've got an opportunity to look at new solutions to old problems. And I'm sure people that are sat in the room probably have old solutions to old problems, which are just as good. But also you will have new solutions to some of those existing problems and challenges that we face across the system. And certainly when we start talking about workforce, so it's how do we collaboratively come together to deliver something for the future. And I think when I started working with Hanan on this and looking at the LEAP programme, I'll be honest, I had many kind of traditional viewpoints of being sat in the VCSE sector and VCSE roles that I've had previously, and around placements and the challenges of paperwork and capacity and all the rest of it, which I'm, like I say, they are very much traditional viewpoints of what I had experienced previously. So today is about looking beyond that and looking at actually what is the programme now, because it's changed an awful lot. Placements have changed an awful lot. The settings that we can put people and offer to students have changed an awful lot. And actually it's much more flexible. So today is very much around what can we do looking forwards rather than looking at the challenges and barriers that we might have faced in the past. And ultimately, it is about that future workforce. So from a VCSE sector point of view, I kind of look ahead and think, where does our workforce come from in the future? What do we want the workforce to have when they do either land in the VCSE sector or in NHS settings? And I think we'd all agree that we want somebody with a wide range of experiences and skills, and that will give them the biggest kind of toolkit to be able to do whatever jobs they've got and do them well. So I'm absolutely confident that the VCSE sector can support in developing some of those skills and experiences. And if I look at it solely from a VCSE sector point of view as well, we do need to increase the capacity of the organisations. We do need to look at sustainability and where people come from in the future to run the organisations and services that we've got. And also it's an opportunity. It provides investment and it provides sustainability for organisations as well as obviously looking after the best interests of our students as well. Next slide, please. So today's session, again, when we started to talk about this and look at how we wanted to broach today's session, it's about having that open mindset. I've already started off down a track of I've got traditional perspectives, but actually this is very much around the future and looking at the opportunity that we've got between us on this call and colleagues across the system and probably other organisations that are not on this call that will want to come in at some point in a later stage. Today is a chance about hearing from experiences, as Hannon's already put up the programme earlier, what their experience is, the benefits, and any challenges that they did have that they've overcome. And it's very much around listening and listening to you and trying to work out actually what are the possibilities, what are the opportunities, and what do we need to have in place to make that happen. And ultimately, it is about that support in the future workforce, growing our own workforce for the future with the skills and capabilities that they need to succeed. And like Hannon said earlier, there is a Q&A session after everybody's presentations and all the rest of it. So feel free to chuck any questions into the chat box as we go through and we'll keep an eye on them. We might not answer them as they pop up, but we'll certainly answer them when we've got the chance a little bit later on in the agenda. So feel free to do that as well. And then I think the final slide is just my contact details for anybody that wants to get in touch afterwards.
Thank you, Gary. Can I invite Fiona to turn your camera on, Fiona? Thank you.
Yes.
Hello, Fiona. Let me introduce you to Fiona for people who might not know Fiona. Fiona is a senior lecturer, occupational therapy in York St. John University and the professional practice placement lead for OT therapy, occupational therapy program. Fiona qualified as an occupational therapist in 1991 and since then has worked in North, West and East Yorkshire as an occupational therapist in a variety of clinical areas, including stroke, local authority, community, forensic learning disability and intermediate care. More recently, Fiona has worked at York St. John, teaching on a range of modules, which include applied skills for practice, moving and handling, palliative care, and placement preparation. Her areas of research around marginalized communities, such as those people who are homeless and asylum seekers and refugees. Fiona is joining us today and giving us a really insightful opinion as from experience extended in occupational therapy and role emerging placements. Fiona, please.
So yes, I'm Fiona Howlett and this is York St John University. So I've been doing placements for about 10 years and took over lead for the placements about 4 years ago. I will talk from an OT perspective today, but much of what I'm saying applies to many other allied health professions. So I'll try and make it as broad as I can. Next slide, please. So what is a role emerging placement? Well, sometimes they're called contemporary placements as well, so the terms can be used interchangeably. We've done them in occupational therapy for about 15-20 years. They're not new to us at all. And I suppose they came out from wanting, there was a shortage of placements many moons ago, and there still is today. And it was about doing things differently and looking at services where there could potentially be room for an occupational therapist where there currently wasn't one. So what actually happens is that the student is assigned to an area of practice where there isn't usually an OT or a physio. We usually send people in twos so that they can bounce ideas from each other. It's much more of a project-based placement and it involves peer group learning. The students that go on these placements have to go back to their theoretical underpinning. They have to go back to what makes an OT, what makes a physio. They have to go back to that theory to understand how that theory is going to work in practice. It helps the students to develop skills to be autonomous, to be self-directed, and to work with minimal face-to-face supervision, which really helps them in the future career. Next slide, please. So the types of placements that we've certainly offered and worked alongside. So we've had students in therapeutic farms. We've had students in mainstream and specialist schools. We've had students in shelters for people who are homeless, students with in women's refuges, therapeutic horticulture, which is my personal favourite, care homes, pupil referral units, supported living for people who are neurodiverse, Forward Assist, which was a veterans charity up in the northeast, supported employment services, and increasingly university wellbeing services, because obviously there's an increasing need for students needing mental health, and then My Sight, which is services for people who are visually impaired. So they're the non-traditional settings, and more recently, we've started to work with organisations, and Hull University Teaching Hospitals being one, to look at services where they would like an OT or a physio where there currently isn't one. So they're in the more contemporary placements, I would call those. So we've put OT students in CAMS services, child adolescent mental health services where there wasn't an OT, in intensive care where there traditionally just been physio and no OT, moving and handling team within a teaching hospital, which you'll hear about in a little while. We've had OTs in GP practices looking more at the mental health sides and long-term conditions of people, and then also in occupational health departments as well. So it's very, very diverse. If you've got a good idea and you come to me, we can generally run with it and make it into a placement. Okay, next slide, please. So in terms of how do you allocate the students, those of you that know me, many of you don't, I spend a long time allocating the students to their placements. It's not just a piece of string and a dot. You know, I really do spend a lot of time getting to know the students and to see what will make them tick, what will fire their interest. So we look at the students' past experience. What have they done before they've come to university? What are their aspirations? Where do they want to work? And have they got an interest to work in a specific area? I also look at the home location because that's important. So if there's somebody that lives in Hull, I will try and place them in Hull. If it's a student that lives in Harrogate, I'll try and place them in Harrogate for the role emerging placements because they tend to be more local. In terms of future aspirations, some of the students do these role emerging placements and realise that that's the future career for them. I didn't put it on there, but we did have a student that was doing hippotherapy with horses in Southern Ireland, and on the back of that started out some family and pet therapy over in Southern Ireland as well. So often it leads students to directions they weren't planning to go to. And obviously a driver, we do try and ask students if they can learn to drive, then it's a very good advantage. A lot of these services aren't, particularly the farms, they're off down beaten tracks. They're not in the middle of town. So we need to consider whether they're a driver and can they get there, because that's really important as well. So some of the practicalities are around. Next slide, please. So I won't dwell on this too much, but just to say that the role of the mentor and the role of the supervisor. So I'll just give an overview, and I know that the next talk will probably say more about this. So the role of the mentor is to provide day-to-day operational support. This is the person that's actually in the placement area. They're not necessarily an OT or a physio or another allied health profession. They could be a nurse, they could be a social worker, they could be anything. But the role of the mentor doesn't have to be the same profession as the student that's going in. They'll answer queries regarding service users. They will give access to records because the students do need to see records, and also a safe place to store notes. And you might think, why has Fiona written that in there? But actually that's the access to records and a safe place to store notes is actually really important, and some things that are often overlooked. In terms of the educator, so the educator does have to be profession specific. So that does need to be, if you're an OT, it needs to be an occupational therapist. If it's a physio, it does need to be physio. Dietitian is the same. So the educator needs to be qualified in the profession that they're supporting. Supervision is for between 60 and 90 minutes per week. And they also liaise with the mentor in the placement area, pre-placement, mid-placement, at the end of placement, just to check how things are going. They also do some negotiation minor comments during the week if there's any queries that the students have, and they also then write up the final report as well. So there's much less in terms of face-to-face direct supervision, but you have got an overview of what's going on, and you are there as a sounding board sometimes for the students when things don't go traditionally and smoothly, as things don't quite often. Okay, next slide, please. So as I said, or as I alluded to in the last slide, then the usual pattern of learning on a role emerging placement is a bit of a roller coaster. At the start of the placement, I'm sure Becky, when she talks, it's really exciting, and it's almost like fear of the unknown. You get to your placement on your day one and you think, right, I'm here. What do I do now? And the first week is all really about trying to make sense of what's happening in the service that they're in, trying to have an induction about what goes on day to day, and trying to understand the remit of the service and the referrals, the type of people that come to that service. And that often takes 2 weeks. The students are chomping at the bit by the end of that 2 weeks, but it does actually take quite a long time. Weeks 2 and 3, it's about liaison with service users and the mentor, trying to establish the type of potential interventions they can offer, the type of projects they might do, and trying to find the evidence to support. This is where the students need to dig deep into the theoretical underpinning to find out the why. It's that why, because plus evidence. Why do we need to do this project? Here's the reason why, and this is the evidence that supports it. So it's very much that why, because plus evidence. And then weeks 4, 5 and 6, that's the juicy part. That's where the students get to do the main part of the work. They carry out the assessments and the interventions. They liaise with service users, the mentors and the long arm supervisor. This is where they progress the work that they're doing. And then the final week or weeks, depending on how long you've got on placement, the students will either write an individual report on people they've been working with, or if it's more of a service improvement, we'll write more of a general report on what they've done and what they've achieved in that time. And if it's about promoting the value of OT and physio, you know, why an OT or physio might be useful in that service and what they've achieved in that time. And as I've said, each student is very different. Some will start with great excitement, panic weeks 2 and 3 that they don't know what they're doing, and then by the end of the time they will fly and really understand why they've done what they've done. Okay, next slide, please. So benefits to the student: they become more confident, they're more creative, they adopt leadership skills, increased sense of belief, they can develop evidence-based services, and it helps their employability. With the service, it can offer a new perspective, a new pair of eyes. For the service users, it's nice to work with somebody who's got time and space to listen and find out what you actually want. So it's very person-centred. Students are generally very enthusiastic, approachable, and they enjoy spending time with the service users. In terms of the whole system, services can be developed and improved just by having somebody working on a specific project. Lots of the projects that the students have done have been implemented later on. And in terms of the profile of the professions, it's very positive. You know, it increases our employability, it increases our profile, increases diversity in some of the settings that we're in, and obviously it helps us work in terms of increasing our work with people in terms of the social justice agenda as well. Next slide, please. So actual roles that have been developed as a result of the role emerging placements that we've offered, there's been an OT positioned in ICU as a result of a role emerging placement. An OT in a CAM service was employed on the back of one of our role emerging placements. The first OT in the post office service came on the back of a role emerging placement. OTs in occupational health have developed on the back of role emerging placements. We've had 2 students in university health and wellbeing services this summer, and one of them has actually got a job in the service that they've left. And then OTs working with asylum seekers and refugees, which is obviously my passion, and we have students working in that area as well now. Next slide, please. So that's me, whistle stop tour. Very happy to talk to anybody who's got any interest or questions about that afterwards. My Twitter feed's there as well as my email address. Very happy to talk to you. And there's some references.
Thank you very much. Yes, I'll get you to the references for people interested. But these these will be shared to all audience as well. And thank you very much, Fiona. It's so insightful, and it's lovely to see how these role emerging is actually transferring to be roles and the choice of where people wants to work. Thank you very much. You will join us in the questions and answers later, if that's fine. I would like to, thank you. I would like to, so bear with us. We've got 3 inspiring speakers next. So I really need to read their bios because it's really acknowledging the amount of effort they've done in delivering this next 20 minutes of trio stories. I would like to invite Rebecca, Melanie, and Chris to switch their cameras on, please. And let me introduce you to Rebecca, or Becky. Becky is final year MS Occupational Therapy student at York St. John University. Becca is a final, she is currently conducting research regarding value-based decision-making and provision of occupational therapy for people with obesity. When qualified, Rebecca would like to work as a perinatal occupational therapist and has a special interest in mental health in parenthood. Between January and April 22, Rebecca undertook the role emerging placement at Hull Royal Infirmary on the safety team with Chris Richard and as a mentor and Melanie Chudley as an educator. Today, she will be sharing her experience in role emerging placement as an OT student and will be shared with Chris Richard. Chris Richard is the head of Moving and Handling Department at Hull University Teaching Hospital. Chris's career in moving and handling began in 2000 when she joined the safety team at Hull University Teaching Hospitals. Chris attended Loughborough University to study back care management, graduating in 2007. Her work involved anything from helping individuals return to work to build design and implementing trust-wide system of work. Chris is an active member of local and national groups looking to improve staff and patient safety through product and system development. Recently, Chris wrote an editor piece for the nursing time on who do hospital beds matter? Why do hospital beds matter? Apologies. After an invention onto a roundtable event on the subject. Melanie Chudley is clinical therapy manager at Hull University Teaching Hospital Trust. Melanie qualified as an occupational therapist in 1992. She commenced the first trust therapy post for oncology and became clinical lead OT, oncology plus cardiology and infection disease. At the break of COVID-19, Melanie provided senior clinical and pastoral support to therapy staff. She became a clinical therapy manager, OT and physio in August last year. Melanie is active supporting international therapists in transition into the NHS and has been an active professional practice educator since 1996. She is dedicated to support her clinical team to provide quality placement education, the perpetuating the development of both OT and physio into dynamic practitioners in their formative year of registration. So I think Melanie, I saw her. Melanie, are you able to turn your cameras on? Just checking.
Mel says she's listening from her phone because the internet has crashed at Huth.
Oh, right. Okay. So are you able to speak? And is there any?
If Mel isn't able to speak, Hanan, I will take her part.
Okay. Okay, Melanie can't speak.
Yeah, she can't speak, so I'll just start. Hi, hello, and welcome to our presentation about our experiences in a role emerging placement. My name is Becky, and I will be discussing my experience of this placement as an occupational therapy student. My mentor throughout the placement was Chris Richards, who has just started a new job as a risk manager, but whilst I was with her was a manual handling and ergonomic lead. She will be talking about her experience of having a student working with her in a non-traditional role. There will also be discussion from Melanie Chudley, who was, or in this case, Chris, who was the educator to myself and worked alongside Chris to oversee my placement. The placement was based in the safety team at Hull Royal Infirmary. To begin with, I attended 1 day a week for 4 weeks and undertook the position full-time for 9 weeks. Next slide, please. I, Chris and Mel were all new to this type of experience, and to say it was full of twists and turns is an understatement. As Mel describes it, I was the rider cycling a Tour de France, and Chris and Mel were the domestiques clearing the way and supporting me to reach the finish line. Next slide, please.
So why? Why did I get involved? Well, basically because I was asked. Hanan convinced me that I had something to offer the programme and a student's experience. She explained how it was an opportunity to share my knowledge and experiences and how it could help broaden the student's perspective of the OT role. I was also intrigued how it would work for me and what difference the placement would make to the student, patients, and the manual handling service I provide as a lone practitioner within a large organisation. So for Mel, she signed up to be a PPE for the rep placement, as she wanted to lead from the front and show a positive example to the therapy teams that she manages, and she was prepared to do whatever she asked of them. Being relatively new to management, it would help her to keep it real. As a recruiter, it would also maintain an active understanding of the OT training and also provide a multifaceted CPD opportunity and by proxy evidence-based practice update. Next slide, please.
So what was my role and what did I do? During the beginning of the placement, I was eager to learn as much as I could and find a place not only for occupational therapy, but for me as a student. The process of finding my feet was quite tricky. I wasn't sure how my placement was going to impact service users when it wasn't patient-facing. After speaking with members of the Trust and Chris, I decided to conduct a piece of research regarding the movement and handling needs of people with obesity and what support was required for the nursing staff to provide these services. This was the start of the hill. In the end, I conducted a piece of research consisting of an online questionnaire, patient interviews, and clinical observations. I found that there might be gaps of knowledge for nursing staff regarding bariatric equipment provision and how to operate it. My occupational therapy intervention was to bring this information to nursing directors via a presentation. I also created reference documents made available on the Trust intranet. Examples of these are on the slide, and helped create a comprehensive page for movement and handling needs specific for patients with obesity. In the end, I achieved much more than I could have expected. Utilising my research theory from university has proven to be very helpful in my continuing education. After my presentation, I received some incredible feedback, and this inspired me to write about the subject for a university module, for which I received my highest mark. I'm also furthering my research regarding people with obesity, and I'm in the process of collecting data for my research project at university. The documents I created are still available, and whilst I didn't have enough time to measure the outcomes of having these resources, they are available for all Trust staff to access. Collaborating with Chris was invaluable, and she really pushed me to believe in myself and the project, and I think I might just believe it now. Next slide, please.
So our role. My role in the organisation at the time of the placement was to lead on manual and patient handling and ergonomic safety. It's a broad remit covering everything from equipment commissioning and building design to safe patient handling systems and training. This broad remit gave me the advantage of being able to introduce Becky to patient and staff issues, trust-wide perspectives and external contacts, for example, specialist equipment suppliers and manufacturers. I arranged for Becky to spend some time with a clinical specialist from our bariatric equipment provider, as well as visit a local equipment manufacturer who was developing a new product to help with the safer handling of the larger patients. I saw my role in the placement as to help Becky keep on track, share my knowledge to help guide ideas, signpost to contacts and information, and open discussion about pros and cons when Becky was exploring avenues of research. So for Mel, as PPE, she ensured that Becky had all IT hardware and trust system access, plus access to the student induction session. In the early stages, she assisted the student with the formulation of the project in conjunction with myself as the mentor. Once the student was full-time and in placement, her role was to monitor professionalism, tracking practice against learning outcomes, coaching through problem solving, and project hiatus, acting as both a resource of knowledge and professional contacts and linking in with the placement mentor, which was myself. The time commitment is an important point to note. This was approximately 2 hours of supervision per week, plus open access to emails and phone contact due to the nature of the placement. So approximately 4 hours per week, plus the halfway visit and final report. Next slide, please.
So what were the barriers? Along this placement, all three of us met with various barriers to me completing the project I had set out to do. Firstly, as we're all new to this type of placement, each of us had to define our roles in the placement. Chris and Mel needed to find the right level of support to give me, and I had to take an autonomous approach to my learning and experience. It was particularly challenging as the safety team is not service user facing. This was further compounded by the changing nature of Chris's role, which involved reduced time spent with service users. To top it all off, the paperwork required for the placement was not role emerging specific, nor did it account for a non-service user facing role, which required some intense emailing to make sure that all of the learning outcomes were going to be met. This was not only a challenge for me, but was also for Mel, who was also unsure about how I was going to meet the outcomes. We overcame this by working together to determine what skills I was utilising and how these applied to the learning outcomes. I think this process helped us to see all the benefits of this type of placement. Sometimes you just have to look at things a bit differently. Secondly, the ever-present COVID restrictions and implications also played a part in reducing the scope of my placement, including at-risk patients such as patients with obesity being told to stay at home. This potentially contributed to the lack of suitable patients to interview for the project. It also meant that staff shortages due to COVID were unprecedented, leading to lack of opportunities to shadow staff on wards and limiting the methods of communication to virtual meetings and email. However, this also meant that placement was incredibly flexible, and I worked from home often, which was helpful due to my 2-year-old. Lastly, due to the limited timescale I had and the extensive approval process for conducting research within the NHS, it was quite a feat to push the research through in the allotted time. Chris worked some magic, and after jumping through many hoops, I was able to conduct my research with all required approval. Next slide, please.
Translating learning objectives. So for Mel, she was trying to fit the role emerging placement to the standard university learning which she found difficult. On the slide is an extract of the brief examples that she gave Becky before her halfway university meeting to reassure her that she would be achieving the outcomes during her project. By the end of the placement and further twists to the project, it was clear that although Becky had had some patient contact, her client group for this project were actually the trust staff rather than the patients. Next slide, please.
So what are the gains? As a student, I feel this placement has given me so much more than I could have imagined. It has given me an understanding of the value of occupational therapy in non-traditional settings, improved networking capabilities, dynamite email skills, friendships in Chris and Mel, and I feel like I've made an impact on service users in the trust. It has also opened up many doors for me, including to inspire me to consider research in my future as an occupational therapist. The biggest gain for me from this placement is the belief I have in myself as a future occupational therapist. Never did I think I could conduct this type of research on my own, that I could take control of my own learning and be so organised.
At the end of the placement, we had a tangible, great piece of work with usable documents and streamlined resources for others to use that will benefit both staff and patients. From a service point of view, it was interesting to see it through a different set of eyes, to explore and recognise gaps in staff knowledge, training and resource provision. As a solo practitioner in a large organisation, it was great to have someone for me to discuss ideas with, and it gave my personal motivation a bit of a much needed boost. It was also wonderful to see Becky growing confidence and passion as the project got underway and started to take shape. For Mel, she said she thought that the neutral position of the placement, independent of the therapy department, gave a different view of OT skills to other professionals in the organisation. This included the senior matrons who had involvement in the project and or attended the final presentation, which in itself provided positive PR for therapies within the trust. Apart from the product of a solid overview of holistic needs assessment for bariatric patients, as PPE, Mel was able to fulfil the role in a much condensed time commitment, similar to that you would expect to provide in a weekly basic, a weekly basic to a newly registered Band 5 therapist. Next slide, please.
So personal reflections. I found the placement incredibly challenging, not only attempting to find a place for occupational therapy in the safety team, but to do this without being in a patient-facing role. Looking back, I did not appreciate the skills and opportunities this role has given me. I especially didn't expect it to widen my career prospects to include research in my future role as an occupational therapist. Being able to impact a wide range of service users with research and influencing policy was hugely rewarding and something I didn't think was possible for a student.
At first, I wasn't sure what I could offer a student on a role emerging placement. And although I have worked with students, many students over the years, it was my first time supporting a placement, working so closely and on such an intense basis. I was a bit nervous and worried that I wouldn't actually do her justice. The process made me realise that although I was aware of issues, I had to loosen the reins and accept my capacity meant I couldn't tackle them all on my own. It was quite freeing to let go and see someone run and embrace the topic with such enthusiasm. And by supporting Becky to take the project forward, I have to admit to an element of proud mum syndrome and getting excited living vicariously through her achievements. The experience has improved my confidence and made me realise I do know what I'm talking about, well, at least sometimes. For Mel, she initially struggled with the concept of the role. It was not clearly defined with the direct control as a traditional placement, and the mentor was very active in the chosen project. She therefore had to redefine her role to an overseer of the placement with a coaching style. As the placement was led by the student, the role required a greater element of trust between the student and PPE, which as an experienced PPE, Mel was actually able to give. It did challenge Mel to constantly adapt the use of her PPE and supervision skills, and she had to be prepared to be what the student and situation needed her to be. Next slide, please.
So recommendations. My recommendations as a student for those thinking about taking on a student in a role emerging placement is to keep in contact with the university and encourage the student to as well, just to ensure that any doubts or worries can be addressed, especially if there is confusion about the learning outcomes as there was for me. I would also recommend keeping up to date with current approval procedures for any work that requires it, such as NHS governance approval, as this can take some time. Lastly, if it is appropriate and the student is confident to do so, let them take the lead on their project. I found the hardest and yet most beneficial aspect of my learning was being autonomous. I checked in with Chris daily and Mel weekly, but I utilised all the other time on my own, much like in clinical practice as an independent practitioner.
So for me, we met briefly a few weeks before the placement actually started, which I think helped calm some of the nerves, but also gave an opportunity to raise and discuss any concerns. Time flies by, so have an idea of the project right from the start. That being said, be prepared to be flexible. Curveballs outside of your control may close off avenues and mean a change in direction is required. Preempt governance processes. Getting audit or questionnaire approval can take time, as we found out. Always keep the end goal in mind to keep the project on track. Exciting leads and opportunities may arise that can take the project in a whole new direction or threaten to explode into something so huge it can become unmanageable with no tangible outcome. Be realistic. As the project gathers speed, you may need to refine expected outcomes, but make sure you celebrate everything. It took Becky a while to join the dots and realise the importance and benefit of something so remote from the patient's bedside. There is an enormous amount of learning to be had, even in the small things. Map everything against an achievement. The student may not necessarily see the importance against the bigger picture. Help them understand that you do not have to be sitting with a patient to make a difference to their care. Recommendations from Mel were to reduce differences in the interpretation and uncertainty, for Mel, To reduce differences in interpretation and uncertainty, define and carve out the roles and responsibilities of the mentor and PPE with all involved at the beginning. She also recommends to give confidence to both student and PPE who are on the course, confirm objectives with the college and how the skills learned in a role emerging placement can relate to the standard learning objectives. Although there was an opportunity to meet face-to-face, in reality, most meetings were held virtually, so not being able to meet face-to-face should not be a barrier to volunteering to act as a PPE. It is important to buddy up with a placement mentor so you can quality check both the progress of the project and student performance. Next slide, please.
So why consider a role emerging placement? I'm still riding the high of all the positive feedback I received from my presentation. I have gained skills, confidence, and I'm inspired to undertake research in my future career. The possibilities for allied health professionals in non-traditional settings, in my case, occupational therapy and a safety team, should not be underestimated. The impact it can have on a student is immense, and what the student can provide your service can be valuable long after they've left.
For me, you can give the student exposure to unexpected and unconventional scenarios that they wouldn't have even thought played part in the OT role. Their fresh eyes and questions can give you and your services challenge about how and why things are done. We can all get stale and blinkered working in the same way for so long. So being able to justify or not how things are done can be the catalyst for change and progress when you didn't even know it was needed. Or it can be the assurance that things are working well and how they should be. Finally, and probably the most important thing in my eyes, is that you can be part of a student's development, helping to mould their career and the future of patient care. So for Mel, the diverse skills that can be learnt during the role emerging placement enhances the student's ability to practice autonomously and adds to their employability. The student can act as an independent reviewer, providing the host organisation with an impartial view of best practice, application of national policy, and/or the basis for business plans. The role emerging placement can also act as a trial for the impact occupational therapy practice in an MDT workplace and service, and the service the host organisation can provide to their service users. The national shortage of OTs is currently on the Employment Risk Register. As clinical practice placements remain an integral part of training OTs, it is therefore imperative that placements are provided for our future staff. For those non-traditional employers who aspire to have an OT in their team, hosting a student can generate interest in the proposed role and act as a stepping stone. Thank you.
Thank you very much, the trios, Mel in the back, but you've done really great, Chris, talking through it as if Mel has done it all. I mean, it's really marvelous journey. So glad that Becky, you've done it at the end, and so glad that Chris and Melanie has enabled that to happen. I also have a proud mom syndrome, so that's fine. Well done. Really, really insightful how your journey has turned to be one of the so significant, you know, to you and where you want to be. So thank you very much. I hope you can stay with us for the questions and answer session. I'd like to, Melanie's here. At least we've got a face now to.
Let's just come on. Hello, everybody. Well done, team. I'm glad we prepared for the inevitable.
Thank you. Our first breakout room is to really explore why. Why do we need to do role emerging placements? was very quick 5 minutes, wasn't it?
It was.
So if I can ask people just to scan this QR code, and it just means to gather all of your ideas that you've just generated through the breakout rooms. So you just scan it or go to slido.com and just enter the code #rep. You can see 3 participants already trying to type, starting typing there. 4, 5, getting on. Permission to think creatively. Like that. Unmuted. Having the university views and seeing like how we can have a great value of the communities and having students' involvement in creating the services that we all want to receive is brilliant. Different outlook, different horizon, autonomous, confidence. Great ideas there, and why opportunities to consider OTs in new areas, offer assurance and challenge on a broaden outlook into the wider avenues. Yeah, transferable skills for graduates. Yeah, broadening horizons. Brilliant. Thank you very much. And would like to invite Lucy. If I can, hi Lucy, if I can ask the rest to turn the cameras off just to improve the quality of recording for us all, really. So Lucy Aldrich is the project lead for Humber and North Yorkshire HP Clinical Placement Expansion Program at Humber and North Yorkshire Health and Care Partnership. Lucy qualified as a physiotherapist in 1997 and has been rheumatology clinical lead at Hull University Teaching Hospital since 2004. Lucy created the Hull Easy model, evaluator, appraiser, student integrated model, in response to difficulties clinicians were reporting when increasing placement numbers. Lucy is currently seconded to the Humber and North Yorkshire Allied Health Professional Clinical Placement Expansion Program. This role involved working collaboratively across multiple organizations to achieve placement expansion and led to Lucy to pilot role emerging placements for physiotherapy students in partnership with Hull University and the National Charity versus Arthritis. Really keen and excited to listen to your experience, Lucy. And I'll be supporting you with your presentation. Just sharing it now.
Thank you.
Okay.
Thank you, Hanan, and thank you, Gary, and hello, everyone. And thank you for giving us the opportunity to present our pioneer role emergent placement, which created new opportunities for physiotherapy students to work with charity members. Many people have been involved in this, but only a few are able to be here today. So I'm presenting on behalf of everyone. So who are we? Hanan, next slide, please. Thank you. We are Versus Arthritis, the University of Hull Physiotherapy course, and the Humber and North Yorkshire Health and Care Partnership. Versus Arthritis is a national charity dedicated to supporting people with arthritis, and our associate is Ashley Alquist, who I think has been able to join the call. And Ashley is the charity's physical activities manager, Many others were also involved from the charity, including regional volunteer coordinators and admin staff, as well as, very importantly, the charity's volunteer leads and charity members. Our associate from the University of Hull is Dr. Sarah Chipperfield, who is also here today, and Sarah is the university's senior physiotherapy lecturer and placement coordinator. There were the 4 students from the university who at the time of the placement were in their 2nd year of the degree course. And then there's me, Lucy Aldrich. As Hanan said, I'm a physio and currently on secondment. And I supported the placement as in the practice educator role. So what did we do? Next slide, please. Thank you. Well, I'd like to share with you about our placement setup. And as already mentioned by Fiona and the previous presentation, a rep is where a student is supported by a service that currently doesn't utilise the student's profession. The service provides access to their service users, and a mentor is based in the same learning environment as the students and supports them from day to day. Next slide, please, Hanan. In our Pioneer rep, the service provided by Versus Arthritis is a remote one, but a physical environment is selected by the volunteer leads who run groups for charity members to meet monthly, and the volunteers receive training and support from the charity to do this. The goal of this rep was for students to connect with Versus Arthritis members in person and deliver activity and advice directly to them. So the students had capacity to connect with group members face to face, and at other times to connect with the charity remotely. So you're probably wondering, what did that look like in reality? And what were the students actually doing? So next slide, please. Thank you. Both placements were slightly different in terms of what the students delivered and the environments they are in. So I'm grouping all of these opportunities together to give you an overall idea of what was available. Each placement lasted for 6 weeks, and the students attended venues where either group members were already meeting or could potentially meet. And so one was in a library and another at a parish hall. They initially met with members to understand what their exercise goals were and then planned what they could deliver. The students met the members twice a week and held group sessions consisting initially of chair-based exercises and also presented relevant advice to them. They set up bocce games, and bocce is a competitive game like bowls that can be played by anyone with or without physical impairments, and you may have seen it at the Paralympics. And they met some members individually to give advice on activity. They also had opportunities to connect in person with other chair-based groups and members of the rheumatology multidisciplinary team. They had remote opportunities too, to produce online activity and advice sessions for the charity's staff members and chances to connect with the charity's exercise practitioners and MSK champions, as well as the region's healthcare trainers. And to be able to do this, we started preparation 8 months before the first placement. So next slide, please. Thank you. So it involved collaborating between many people who are mentioned at the start and who I've represented here by markers on the left. There were multiple meetings before the first placement. I haven't shown them all here, and we are still connecting with each other. So we're preparing for the next placement. Next slide, please. Thank you. There have been lots of challenges around setting up and supporting this placement, and I'm sure that you've already thought of some. And I'm going to share the headlines with you, but please connect with us if you want to know more specific details. So to give the pilot its best chance of success, Versus Arthritis identified an established group who met regularly and were supported by experienced and open-minded volunteer leaders who had a trusting relationship with the charity. The charity also screened the venues to check they met the standards required for the members. And the university approached students who were happy to support the pilot and who had worked either delivering group exercises before or had managed complex and challenging situations. Students were paired together for peer support and to mitigate lone working risks. And the students used tools from the Hull Easy model to evidence and structure their remote learning and to make their thinking visible to me. The students revised health and safety protocols to make them bespoke to each placement and their needs at the start. And we used WhatsApp a lot so that the students had direct access to myself all day, every day. Safety of the group members was a high priority for everyone, and all participants were screened and signed disclaimers before starting. Students planned and shared their interventions prior to delivery, and hands-on assessments were dropped as there was no on-site supervision. And data protection was managed by anonymising paperwork and creating handheld records for participants. Regarding costs, short-term solutions were found to fund the additional venue hire needed throughout the placement, and also to distribute the tariff equitably to reimburse the time and resources invested. There were unexpected risks, including Omicron, which required the charity to rapidly lead on protecting its group members, and managing risks around prolonged sick leave. And although we can't plan for the unexpected, we have learnt the value of creating a plan B for almost everything. Next slide, please. There were, and there always will be, challenges around communication and relationships when so many people and organisations are collaborating together. And we have been collaborating for over a year now and developed our relationships in parallel with the placement growth. And we are learning how to effectively support those new to this venture and develop their trust and respect quickly. And by sharing ideas, we've found ways to cross the IT firewalls of large organisations and found ways to share resources like the charity's brilliant bocce kit. And we are recognising how the absence of a common language about this non-traditional placement can impact on students' perceptions as they've struggled to convey their experiences with their peers and the evaluation process. And this unfamiliarity also challenges us about conveying the complexities to new partners and students. We learnt to have weekly meetings during the placement so that we can make timely adjustments to our shared goals and priorities, and to keep each other up to speed with changes from our own organisations or external factors that can change at pace. Next slide, please. Thank you. Many outcomes were generated. The students created and delivered multiple sessions to charity members face-to-face and to staff virtually. And the feedback was positive across the board, highlighting a strong desire for more placements like this. The students evaluated all their activities using a variety of outcome measures, including the EQ5D, and they created many resources, including a booklet for the group on how to safely continue their exercises and videos about their experiences and for the next student's induction. All students successfully achieved their placement learning outcomes, and following the evaluation, the university sees it as a quality placement worth repeating. And the positive outcomes are unlocking the potentials for all involved. And on to the outcomes for the participants. Next slide, please. I'm starting on the left-hand side of this slide. So although 6 weeks was not enough time to influence strength or endurance, the outcome measures demonstrated that it was long enough in both pilots to influence participants' mood, address loneliness, motivate members to become more active, and form bonds within the group. Group members reported how good it was to see others in the group progress and be able to help and encourage each other. This motivated them to keep coming back and attracted more members, as the attendance rates almost tripled from 8 to 23. The participants were inspired by the activities the students brought to them. The majority now want to meet every week to play bocce and have asked the charity to loan the kit beyond the placement. And the circuit exercises have been added to the group's monthly meetings. And new members can refer to the exercise booklet created by the students. The students bridged the gap between the group and the local health trainers, who are now connected with the group, and also between the group and the library services, where following student-led discussions, a third of participants have started the library's weight management programme. And finally, many participants stated that the students had brought healthcare to them, and this has encouraged the participants to link with the university about what placements they want and when they want them, and they're asking if other health professional students could come too. They said the experience made a difference to their motivation and commitment, knowing that they had a voice and could influence their community's health. And looking to the future, we can see that this pioneer rep has the potential for not only creating a learning environment for students, but can influence local community health, bring people together, and help overcome social isolation, with the potential to impact on waiting lists and long-term healthcare. Next slide, please. Thank you. And we continue to learn and work together, and we are all very happy to share this in more detail with you. And we would really like to hear from you if you've done something similar and what you learned, and to connect with you to update you on our developments. So please get in touch. And again, thank you for giving us this opportunity to share.
Thank you very much, Lucy, for this insightful pilot. I think with all the challenges that you've faced, you've made it really look like you've empowered the service users to the level that they're demanding it now. Really brilliant to hear that.
Thank you.
Thank you very much. Thanks. I'd like to invite next Sarah. Would you mind turning your camera on, Sarah? Hello, Sarah.
Hi,
Hello.
okay.
Yeah, I'm good. So Sarah Pemberton is the Regional Learning Environment and Placement Lead for North East Yorkshire in Health Education England. Sarah began her career as an adult nurse in 2006 and worked with cardiology. She has also gained her midwifery registration in 2014. Sarah enjoyed her clinical career but felt needed a challenge. Seconded to Health Education England team and is fascinated by the incredible work that she does. Sarah is passionate about preserving the longevity of the NHS, supporting the passion and high-quality practice-based learning opportunities for nursing, midwifery, and allied health professional students within NEI. Through the continuation of clinical placement expansion program, CPEP, in an integral part of developing and sustaining a future workforce. And Sarah is going to talk through how the tariff in placement is supporting the all of the innovative ways that we're going to do it in the future. So I'm still sharing, yeah? Yeah.
Ah. So hello everybody. So Hanan asked me to come along just to talk to you a little bit about placement tariff. Now I am by no means an expert in the field, but I'm here just to provide an overview of specifically clinical professions and the tariff that you could be receiving. So prior to the introduction of placement tariffs, payments would for training placements were subject to just local arrangements, and therefore there were lots of inequalities in payments. Hanan, can you just go to the next slide, please? Thank you very much. So the purpose of placement tariffs is to ensure that providers are reimbursed consistently for the training placements that they're providing, and also to ensure that placements are high quality and ensuring that learners can develop the skills and knowledge they require to meet their respective professional competencies. Next slide, please, Hanan. So here is a list of some of the examples of what tariffs should be used to fund. So these include direct staff teaching time within a clinical placement, teaching and student facilities, and this can include access to things like library services, any admin and infrastructure costs, pastoral, supervisory and health and wellbeing support, which I think is so important at the moment, any student training accommodation costs and staff training and development that relates to their educational role. What the tariff doesn't cover is things such as tuition fees and any items that are funded under the educational support. So things like programme directors, exceptional travel costs. There is a full list of things that aren't included on the full guidance, and I've included the link later on in the presentation for anybody that just wants to have more of an in-depth read. Next one, please, Hanan. Thank you. So the intention of clinical tariff is to provide a contribution to the funding of coordination of placements and practice-based learning opportunities. So these are all the eligible clinical professions. I think this is really interesting to look at. I know I'll be the first to admit that coming from clinical practice, I didn't realise how many professions were included under the umbrella of AHPs. And I know I've spoken to AHPs that didn't know they were AHPs. So I think it's always nice to see that list of who is included. And just to note that I've highlighted pharmacy because they're a new addition from September. They're newly eligible for the tariff as well. Next slide, please, Hanan. So this is just a breakdown of the rates. There has been an uplift this year. So from the 1st of April, we are now paying 3,933 plus market force factor per full-time equivalent, and that equates to 37.5 hours. Per week. As of September, there'll be a further uplift, and that'll go to 5,000 plus MFF, and again that's for 37.5 hours. I have given the weekly and hourly breakdown there because I always think it's quite nice to just see it in those broken down figures. Market forces factor can vary across organisation and geography. It can be as small as less than 1%, and these are set by NHS England. So tariff is calculated over 40.8 weeks, and that's so that it's consistent across all parts of the UK. Paramedics were a recent addition last year for non-ambulance placements, and there has been issues with non-ambulance placements in the past. So I think that's a really good addition. And like I say, pharmacy is also newly eligible from September. Tariff also continues to pay for simulator placements throughout 22 and 23. And again, I think that's really important. Since COVID, there's been more simulation out there, and I think it's certainly set to continue and rise. So again, a really positive addition. Next slide, please, Hanan. So this just breaks down the process of the tariff payment. HEE supports the process. So what happens is the placement activity occurs. The HEIs then submit that placement data onto the student data collection tool. The placement provider is then asked to validate that data, and then the payment is made to the placement provider. Once it's received, it should then be allocated to the Learning and Development Department so that it can be reinvested into education and training, with a result that we have a really high quality and placement capacity hopefully is enhanced as well. And the next slide, Hanan, this just looks a little bit at the student data collection tool for anybody that's not aware of it. So the data collection periods are broken down into 3 chunks of time. So the request is made for placement data from the HEI, and that happens over about a month. That then comes to HEE, and they, following that, request the placement provider, to then validate that data. So during this period, there are 2 reports published. During stage 3, an unvalidated report is published, and then following the validation from the placement provider, we get another report that's a validated version of that information. Next slide, please, Hanan. So key points, the HE is responsible for administering the tariff payments to placement providers, and that's in line with the Department of Health and Social Care's tariff guidance. There's the link. There is a lot of information on there, but it is really quite a nice document to follow. The guidance is reviewed on an annual basis. Placement tariffs are applicable to all placement activity that takes place in England. There are some explicitly listed excluded places, and again that is on the tariff guidance, but over and above all are included. The flow of funding is supported by the educational contract, and that's previously known as the Learning and Development Agreement. Now, for private, independent and voluntary organisations, they can vary slightly. So an education contract can be held by all providers looking to work with HEE, or they can use something called a networked contract, and this is where a HEE may receive the tariff, and then they act as the host to then pay the organisation the tariff accordingly. For more information on this, because as I say, I don't have all the information, the education and commissioning team do have lots of information around that, and it is a developing process. They are looking at how this can be improved. So we're keen for tariff to be used to support the increase of placement capacity, and for all of these different and new ideas, some of which have been talked about today. So the future ambition is that we really work with providers to better understand how the tariff is utilised. As a clinical practitioner, I will admit that I didn't even know tariff existed, and I was an active supervisor assessor. I was a ward sister that worked to try and increase capacity in my area. So we are aware that it doesn't always get to where it's supposed to, and moving forward we really want to make sure that tariff is used to really expand the capacity and to improve the quality of placements that we're providing. And all of that information can also help to benchmark and inform any future guidance documents that are produced. Thank you, Hanan. Apologies, because I think I flew through that. I don't think that took 15 minutes.
No, thank you very much, Sarah, for a very informative presentation. I think there's a lot of work to do around finding out more about the guidelines and this new innovative ways of doing things, and make actually the process happen, isn't it? Thank you very much. I will hand over to you, Gary, who will take us through question and answer session, isn't it?
It is indeed, yeah. And we're almost back on track, I think, in terms of timing as well. So I've just put a note in the chat to for anybody that has any questions for any of our speakers that you've already heard, or anything that's popped into your mind as we've gone through this morning, this afternoon, sorry, losing track of time. Do pop them in the chat. We did have one very early on for Fiona from York St John. So it was from Philippa. Do students choose the service improvement or the intervention? So I think that was when you were talking around the placements.
Yeah, it's a bit of both actually. The students work alongside the mentors to agree what service improvement might be suitable, and then the students observe the actual placement and discuss with the mentor and look at what potential interventions are possible. So it's very negotiated, and it depends on what the service users actually want as well, and what's doable within the time frame. So it's very negotiable. And if you think there's a very short margin of time when they can actually do any interventions, they've got to be realistic in what they can do and not promise the earth as well at the same time. So yeah, does that answer your question? It's a very negotiable feast, but yes, it can be both.
Absolutely. Yeah, no, absolutely answers. And I think that highlights the flexible nature really of the programme and how things can be worked out. So no, that does answer the question. I think there's another question as well that I saw in the chat. I'll come to you in a second. Actually, no, Melanie, let's bring you in first. Let's see if
I was just going to say, in answer to that, I think where it happened, we'd got together and myself and Hanan and Chris, and we kind of had a bit of a chat about what was possible, what maybe things that we wanted to look into, and then we put them as like a starting, like a bargain on the table to Becky, and then from that she looked into that, saw what she thought might be of interest. I think it was her that came up with the bariatric in the end, because that made it more kind of ring fenced a bit more, shall we say. And I think it was then she went off with some ideas and looked at the evidence base on a research when she was doing her kind of 4 weeks run into the main placement. And then that's when she kind of consolidated on what the topic that she wanted to do. I don't know if that helps people, but that's kind of how it happened. So, because I think we were very mindful, Chris might come in as well, but we were very mindful that to do the placement, it needs to be something that student wants to enjoy, and student can, if it's something, it's a bit like doing your dissertation, isn't it? You have to kind of like it at some point, because by the end of it you probably don't. So that's the kind of way that I went with.
No, absolutely, that helps a lot. And I think so I was going to cover that. We had another question through on the on Slido in terms of Q&A, and I think all of our speakers in terms of providers and universities in particular put the kind of list of where the students have gone to and the placements have been made. So I suppose there's a question to provide at universities and those looking after students in terms of what other disciplines can benefit from a role emerging placement. And I suppose also from my perspective, have there been any requests that either have been unmet or have been difficult to achieve? So I don't know whether who wants to come in on that to start off with. Fiona.
I don't mind answering. Role emerging placements, it's just having the willingness to do it, really. I think anything's achievable if you've got you need to plan, you need to prepare, and be organised, really. And I think if you've got a commitment from the people that you're working with, so if somebody's not had a role emerging placement before, they need support into how to do that. But it's doable. If you've got a good idea, approach your local HEI and go with it. Can we do it? Usually you can. You can only say no, and I've very rarely, I don't think I've ever turned one down. So yeah, we actually have too many offers sometimes to match the students. So yeah.
That's very, very good to hear. And I think from a VCSE perspective, and just going back to, I suppose, my introduction in terms of why I'm involved, certainly if there's any requests that we think VCSE organisations can help with, but we haven't made those links yet, that's why I'm in post to make those links as well, and very much would like to see more VCSE organisations involved, because they probably don't know that they can provide placements and something for students, which is exactly what we've heard today. I just have one more question, and hopefully it's a quick question, but it was those challenges in terms of data, and I think this was Lucy, your presentation. You said that you'd got through firewalls, I think you put in terms of IT systems, and I just wondered whether or not there was something in all of those placements and providers in terms of how you've got around the data agreement side of stuff. And I don't think we want long answers because data is not anybody's favourite topic. But is there templates and bits and pieces that are almost, we can adapt that for other providers to make that a little bit easier?
We didn't use templates. We used Fiona's brain a lot to help us figure out ways of addressing the specific issues that we had. But certainly everything we've done, we can make available. The majority of what we've done is already as resources for the next students. We can share everything that we've done in order to make that easier. But yeah, that's not a problem. But I think it depends on the nuances of each of the placements. For us, it was because they were out in an area where the service wasn't active in that area. So it wasn't like we could store notes in a cupboard because it was in a library hall, it was in a parish hall, so there wasn't an ongoing service there. So like I said, we had to find bespoke ways of addressing those issues. And like I said, and it took several conversations. It took a lot of, I think it took about 5 weeks, and talking through with Fiona about how do we square that circle, and before we hit on what we needed to do. So it took a long time to get there. So yeah, there isn't an off-the-shelf thing, but there are certainly any resources we can share, but certainly picking other people's brains, experienced individuals like Fiona, sorry Fiona, is certainly the way to go forwards. And obviously myself, Sarah and Ashley, we're all three of us are coming from different backgrounds as well. So if you're coming from a charity as well as are you, Gary, but I said I'd contact Ashley, and as well as Fiona, obviously. Like I said, there's Sarah who's run the placement already as well.
Perfect. No, I think what I'm hearing very much is we've got many people out there that have probably faced some challenges, and there's people that will absolutely share their experience and learning. And I suppose, Hannah, this is also where you come in terms of coordinating some of that as well. So I'll come to you before we then set up the breakout rooms in just a second. Hannah.
Yeah. I mean, this is the whole thing about today, is really to bring people together and start conversations. There's brilliant pilots here and there, innovative ideas, people who are going into health and care professions studying, that they have passion around working in a particular area. And I think this is where the model allows the individuality to grow, and as a system, as a leaders across all the systems, will make it happen. And I think the ultimate goal, and I hope that I'm not really too much high in the sky, that we will pull together from today and the next breakout session, say, what do we need to make this happen? And the LEAP program is committed to support all of these initiatives that is going to come from today. Anybody who's got an idea, or even just thoughts, even just starting with thoughts like, oh, I would like to consider that. Please please show us your interest. Because we aspire in LEAP to really produce system and whatever templates, whatever processes, pathways, to enable any new providers step into this pathway and be feeling, initially might be needing support, but then it's just business as usual, because we've got proof of concept that is working, proof of concept that the students loving it, proof of concept that students are creating these roles and actually being employed in these roles. So what we need is just to create these pathways to be simple, easy, friendly. Long arm supervision is another thing. Say, oh, how can we organize long arm supervisors? I've got lots of friends from an occupational therapy that they dropped the hours. They're working 2 hours, 2 days a week, and they love to be supervising students on the way. So we've got lots of ways to say, how can we accumulate all of these long arm supervisors, that we have a pool of supervisors that support different services. So we really can aspire to see things growing from today. And it's just the beginning. Today is just the beginning to say like, oh, there's a sense of really interest here. And we can share, how we develop this is by building like maybe working group, experts coming together, joining us. We just really need to feel how is it going, any interest in this region, and we move it forward. That's our commitment from LEAP program.
No, that's perfect. And that sets up the next breakout room really well. And it looks like you've already got some interest in the chat in terms of interest to develop a role emerging placement. So I'm sure that will be followed up. The next breakout session really is around, like Hannah said, what will make it happen, whether that be from an education sector, VCSE sector, a placement point of view, what's actually going to make role emerging placements a success, and how can we offer more to more students. And I like to frame this, like I said at the beginning, there are challenges and barriers, and we've had some of that as we've gone through and how they've been overcome. So I like to frame this in terms of a kind of yes if question. So actually, yes, we can make this happen if, yes, we can if the data agreements are in place. Yes, we can if the paperwork is reduced. What is it that's going to make your organisation or an individual be able to engage with this programme? And I'm going to chuck a couple of extra kind of caveat questions into the chat just to help discussions. But I think we're probably going to have 5 minutes or so in breakout rooms. We will come back and we'll do the slider as Hannah just put on the screen. So again, people get your phones out whilst I'm talking and scan the QR code to make sure you've got the right slide so you can put any thoughts into the question. But this can be anything from an organisation point of view, an individual point of view, what's going to make role emerging placements happen across Humber and North Yorkshire. And like I said, there's a couple of things in the chat as well. So over to you, Hannah, to put us into breakout rooms.
We'll just go ahead with another 6 rooms like before, just enables people to participate and feel fully able to say. Use Slido to put your thoughts while you're in the room or when you come back, it's up to you. And we'll give it a good 10 minutes, I think. We've got some space for that, Gary. What do you think? Come back at around 15:50. Is that okay?
Yeah, that's fine.
Well,
we're already getting some comments on the screen.
Comments on, yeah. So I'll open the rooms now. Hello, back. Are we all back? I think so. I mean, we had a very, 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 great, conversations here in our small breakout room that I failed to really send the participants into the breakout room. So we did our own breakout room. I can see Slido is full of ideas how we can make rep happen. I mean, I can scroll up and down, Gary, if you want to, highlight some.
Yeah, I won't go through all of them because, like you said, in our breakout room, we had some really good discussions, and I can see people now that have come back from those discussions and starting to add more and bits and pieces. So I think it's certainly something that the LEAP team, I'm sure, will look at these and see which ones can be done from your perspective, but then also kind of what other people can do. So I suppose if I just give some feedback from our point of view, and in terms of what will make this happen, it is taking the approach of going into this, not everything's kind of black and white and a step-by-step process, and actually you have to step into this thinking that actually there is a way of working. People are going to come together and problem solve and work out the kind of what needs to happen. And we had a very good conversation around the students that are coming in are very much equal to the staff that you already have in different organisations, and actually they are part of the team and part of the problem solving, part of the resource, if you like, the staff resource to actually do things, and it's very beneficial to everyone. But I think just picking off some of the bits and pieces off Slido as well, there's obviously things in there in terms of commitment, creating that space and time to discuss, I suppose, the challenges, the operational kind of details, the finer details that need to be known before placements can start. And it's about building those open and honest relationships. Like I say, I won't go through them all. I think a bit of a synopsis of all of them is it's people and it's relationships, and it's building that trust that will ultimately make role emerging placements happen, and having that open mind going into this in terms of what could we do, and what are the benefits of what could we do, rather than thinking of challenges and barriers, because you will sit forever and a day thinking of barriers. Whereas if you think of how do we make it happen, it will happen. And we heard that through all the examples.
Yeah. And it was very interesting to see, like, if we think about every learner has at least one role emerging placement, which inspires the community to really look beyond the traditional roles. How many are we telling the new generations who's thinking of health and social care careers? Oh, that's interesting. Horse riding, pet career, you know, all of this innovative way, because we're hardly meeting the basic needs. But these are all emerging is going to really, in a way, push the roles into all of these sectors that is really having a role in maintaining our fitness and well-being in the community. And imagine if every student's got that chance to really embrace that uniqueness and individuality and really be able to do a role emerging placement where they love to do it, you know, it's really lovely. I think there's 2 participants still typing, so just allow that to emerge. And then we've got, we can move. I mean, it's brilliant ideas, and I promise we will generate all of this. We'll take it back and generate some sort of ideas. We've got the attendees today as well, and we can really maybe contact you later if you showed any interest. We've got QR codes coming next to, hopefully you can trigger on your mobile or use the link in chats. 2 of them. One is to express interest. So we're not asking you too much, just name, email, your role, and expression of interest. And another one, feedback about today, because we would like to do some sort of understanding. Are these events useful? What was good? What could be improved, and build on it? So we've got one. Oh, we've got all responses now. So I think we can move to the next slide now. Thank you very much for all of this. Yes, QR code and 2 links will be posted in the chat soon. So if you just click on the links or use the QR code, activate the page. You don't need to really respond to it now. However, 95% of feedback is gathered straight out of the event. If we pass the event a day, you're less likely to have feedback. So I really, me and Gary would like to really thank you very much for today. Your participation is, without it, we couldn't have moved anywhere. We've got very insightful and aspiration within the LEAP program to really help in looking new ways and establishing the roles and encourage the careers and the generations to really think that these careers are really cool, they're really good, they're kind of like diverse, inclusive. There's one QR code here for expressing your interest if you really want to be part of, if you're an organization that would like to consider it, even just thinking about it. You don't have the resources, you have nothing, but you're thinking about it, please leave your email, and you know, we will take it further with you. The next QR code and the link in the chat is for your feedback around the event, and really appreciate if you can give us feedback about the event today with all of the speakers to help us improve on these events in the future. Otherwise, I really thank you very much for attending today. As I said, 95% of the feedback is received straight after the event. Afterwards, is less likely to have feedback, and the feedback is so important. It's just what keeps us going, really. But thank you very much. We're 4 minutes beyond the 4. Thank you for all the time, and I hope the event has inspired you in a way or another. And feel free to, once you open it, to leave the event. Thank you very much for today.
Thank you all. Cheers.